Hi, everybody. My name's Eric Giles. I'm the lead rad tech for Sterling Medical. And today I am going to teach a small radiation safety class. As per the health departments of Idaho, Utah, and Wyoming, we need to have a radiation safety class, and everybody that has anything to do with X-ray needs to watch this and document that they watch this. So in each clinic, there's going to be a sign-off sheet in the X-ray room that says radiation safety class sign off. You'll just have to watch this video and sign that you've seen it. Okay, that's going to help us be compliant with the state health agencies that monitor our X-ray equipment and personnel. So let's get started. Uh, so, like I said, this is a little bit about radiation safety. We got to realize that we are dealing with radiation and it can be dangerous in large doses. That being said, our equipment, we don't use large doses unless we make the machine do a large dose, which we just very seldom have to do anything like that. So let's just run through some of these things so you have a little better understanding of what I'm talking about and things that you need to look for. Uh, so there's a couple types of radiation. There's ionizing and non-ionizing. Okay, ionizing is what we deal with. Okay, that's X-rays. Non-ionizing is kind of like a microwave or the sun that you can protect yourself from with minimal protection, like sunblock or something like that, or even a piece of paper with some types of radiation. Whereas ionizing radiation, we need to use lead is what we use. 0.5 millimeters is the minimum amount of lead that we can use to protect us and others from the harmful rays of ionizing radiation. So, like it says here, ionizing radiation or X-rays can be harmful and can damage human tissue at a cellular level in large doses. Like I said before, we don't use large doses primarily. When we're shooting extremities or anything like that, we're using a very small dose of radiation, which is actually metered by the machine in most cases. Now, when we start moving on to not so much chest, but spines, abdomen, and pelvis, we are using a little bit more radiation, especially for a larger patient. That's where we need to be careful and pay attention to our positioning. Make sure we're getting stuff on the first try. Okay. Human tissue has different sensitivities. A low sensitive part of the body would be like muscle or connective tissue. High sensitivity would be like mucous membranes, the esophagus, eyes, thyroid, things of that nature. That's why we cover those up when it's possible. Okay, very high is lymphocytes or reproductive cells. Okay, that's why we pay particular attention to small children, unborn babies, pregnant women. We take great care in covering them up when we're X-raying if it's not in the field of view. That's something to keep in mind, that there are different levels of sensitivity. Okay, like for instance, if we're shooting a hand or something, we don't need to cover up the forearm. Okay, that would be muscle or connective tissue. It's not real sensitive. But if we're shooting a hand or a forearm on a child, we want to cover their lap up, to cover these reproductive cells. Thyroid's another one. All clinics should have a thyroid shield. We don't use them a lot, but it's something that we need to know that we have and that we can use if a patient asks to have their thyroid covered. We do have thyroid shields because it is highly sensitive to X-ray radiation. So radiation dose is cumulative. meaning that you don't get an x-ray and it just goes away, okay? If we were to get 4 x-rays today, that's going to compound on top of each other and show up as a cumulative dose of x-ray. That's why we need to be really careful when we're x-raying people and try to get our x-rays done on the first picture if possible, because we don't know what people's history is. Maybe that person had a bad injury or cancer and has had various CAT scans. CAT scans carry a large amount of radiation. For example, one CT of the pelvis is equal to 100 chest x-rays. Okay, so you can see there's a large difference between CT and x-ray. Same radiation, just more of a dose with CT. And as what I'm saying, if a patient has had 10 CTs in their lifetime, their cumulative life dose is creeping up there. So we need to be careful with all patients because, like I say, we don't know their history. Number 5 is ALARA. That is something that you're going to hear a lot, especially when we're studying for our LRT boards. ALARA means as low as reasonably achievable. Okay, need to remember that. ALARA, as low as reasonably achievable. That is saying that we need to keep our techniques down as low as we possibly can to get the best picture that we can. I.e. using a higher kVp technique, you're going to get lower dose because your mass is lower, and mass is where your dose comes from. It just all depends on what you're shooting and what kind of contrast you want. The higher kVps, you're not going to get the contrast that you need sometimes for a pelvis or a spine. So we do have to use a little bit lower kV and higher mass, which is a little bit higher dose. That's where positioning comes in. Need to position well. Optimize radiation dose, we just touched on that a little bit. Only use the dose needed to get an optimal image. So we need to concentrate on using as high kVp as we can and as low as we can to get an optimal image. Okay, just keep that in mind. The lower your mass is, the lower the dose is to the patient. Distance has a lot to do with that as well, which we'll talk about in a minute. Positioning is very important. I've touched on this a few times just in this video. Learning positioning is so important. Position that body part where you need to position it, okay, in order to see the entire region of that we want to see, okay. So positioning, learn your positioning, watch the videos, and practice. So we're getting those images we need on the first time, and we're not cutting body parts off or using a poor technique and not being able to see what we need to see. Okay, collimating is very important. Collimating is limiting the X-ray beam itself. Limit exposure to surrounding tissue. So if we're shooting a finger, we don't want our collimation wide open. We want to collimate to the adjacent fingers to include them, and that's all you need to see. Okay, we don't need to see their entire forearm, elbow, and humerus. Just pay attention to your collimation. And I've talked a lot about tight collimation. The more you collimate, the better recorded detail you're going to have on your images. So pay attention to your collimation. It not only helps your image quality, but it also limits the amount of radiation that your patient is getting. Number 9 here is avoid retakes. It's the number one reason for overexposure on people is retaking an image because you're not positioning well or you're not thinking about the techniques that you're using. We do have technique charts in all the clinics. Techniques are programmed into the X-ray machine. And 9 times out of 10, the technique that comes up on your machine for that body part is going to work and work really well. The only time we're going to have to change that is if we have a very small patient or a very large patient, or sometimes pathology, we need to change it a little bit. But pay attention to the technique charts. If you have a question on the technique you're supposed to be using, first look at the technique chart. I have technique charts in every clinic that say small, medium, and large techniques. If you still don't understand that or have a question, please call me. If I don't answer right away, I'll get back with you as soon as I can, and we can, off the patient size and weight, I can get you in the ballpark to get an optimal image on that patient. So avoid retakes, okay? Shield whenever possible. Okay, there's a lot of information out there now about not shielding patients. I am of the opinion that we need to shield whenever we can. Of course, we're not going to shield a body part that we're trying to look at, right? If we're shooting an abdomen on a patient, we're not going to shield their abdomen or their pelvis because we need to see that area, okay? But if we're imaging a body part and we're able to shield the patient's lap or thyroid, by all means, use the lead that's there. Protect yourself and the patient. So shield whenever possible. Time, distance, shielding, the big three of radiation protection. Okay, time meaning your technique time. The more mass you use, the longer the exposure is going to be. Okay, so we need to pay attention to that. Use as low as mass as you can. Make that exposure as short as you can. Okay. Distance, we need to get ourselves as far away from the x-ray machine as possible when we're doing x-rays. As operators of x-ray machine, we need to take care of ourselves, right? Because we're there all the time. We're the one taking the pictures. Get yourself behind the lead wall that's there to protect us, okay? Unless you have to help position a child or an elderly person, make sure you're wearing a lead shield to protect yourself, okay? So distance is a big one. We need to be at least 6 feet from the machine for that x-ray radiation photons to dissipate. 6 feet is a good rule of thumb. Shielding, like I say, shield whenever possible. That's why it's there, right? Okay, and if you ever have any questions, I've had a couple really good questions about shielding. One young lady asked about shielding, and she had read that we're kind of moving away from shielding, that it actually can hinder the picture that we're taking. And it can, however, with the machinery that we use, we don't have automatic exposure control, or AEC. As well, how that works is you take your picture and there's a couple photocells in the image receptor, and the image passes through the body and hits that cell, and once that cell reads that there's sufficient energy coming through the body, it'll shut the machine off and give you an optimal picture. But we don't use that at Sterling, okay? And then, if we're using a shield, it's going to hit that shield and it's going to put way more x-ray energy through the patient and give us a suboptimal picture while overexposing the patient. But where we don't use automatic exposure control, that's not an issue with shielding, okay? The shield is always going to block the x-rays that we want it to block, okay? So she was worried that we're affecting the image that we're trying to take when using lead. But that's not the case if we don't have automatic exposure control, which we don't. So we need to shield whenever possible, okay? So things that we're doing here at Sterling to facilitate the use of x-ray and doing a good job is educating in safe operation of radiation and producing equipment. And that's why I'm here, okay? To teach you guys how to take x-rays, how to take proper x-rays, position properly, and using your techniques the way we should. Education is a big one. And I appreciate those that come to my class and have learned. I've seen a lot of improvements since the classes have begun. If you have a coworker that's not watching the classes, I urge him to watch them. It's just a little bit of your time, and we can become really good X-ray operators. Okay. Use protective devices whenever possible. We talked about that. That's why that lead's there. Get behind the lead wall. Cover yourself up when you're helping position. If you've got a woman in there of childbearing age, which by book it's ages 0 to 55. Okay, so if you have a lady in there that's in between those ages, we need to get a pregnancy waiver signed, as well as cover that patient up as well as we can, as long as it's not in the region of interest. Okay. Follow established protocols and procedures. There's certain images that we take for every body part. Okay. If you have questions on that, look at the technique chart. It's going to tell you what positions you need to take as far as protocol goes for that body part. We also have policies and procedures on protocols. It tells you exactly what's expected. The only time that changes is when you have a provider that wants a specialty view or something of that nature. And if that ever does happen and you have questions, please give me a call and we'll walk through that. So follow established protocols and procedures. You get in a room with the patient. Patient says, we're x-raying a hand. Patient says, hey, my elbow hurts too. We're not going to just x-ray the elbow. That has to come from the provider. Okay, so that patient would have to speak with the provider and ask if it's appropriate to x-ray that elbow before we x-ray it. Okay, so we're going to stick to the established protocols or what the provider wants. Select technical exposures that reduce radiation exposure to patients and themselves. Okay, and we've talked a lot about that. Use those technique charts and stick pretty close to them. That's going to give you the best image without overexposing your patient. Okay. Wear your radiation dosimetry badges. Right there. Okay. So whenever you're at work and you're working clinical, you're expected to wear this badge. Okay. Even if you don't take an x-ray the entire day, just get in the habit of when you get to work, take that badge and put it at collar level. Okay. You don't want to wear it on your belt. Then we take an x-ray, make sure that it is outside of your lead. Okay. It doesn't protect you from radiation. It's just a way of knowing how much radiation you are exposed to during that time. So we check those every 3 months, quarterly. And if you ever have any questions, we can obtain a copy of your radiation dosing, how much radiation you are being exposed to. Okay, so bottom line, wear your dosimetry badges. If we ever get a check from the state, that's one thing that they're going to look for, is to make sure we're wearing the dosimetry badges. Okay, so take good care and wear those badges. Don't take it home with you. If you leave it out in the sunlight, that's just going to read that you're getting more radiation than you actually are. So, okay. Benefits of good practices: minimize the possibility of causing damage to healthy biologic tissue. And that's why we're doing this today. Okay, X-ray radiation photons can be damaging to cells. Okay, it's as simple as that. There are areas that are more susceptible to it. So please take care in what you're doing as far as technique goes. Cover your patients up when you can. If it's not in the region of interest, by all means, put a lap shield on them, put a thyroid shield on them, and take care of yourselves. Okay. If you're out there near the x-ray beam itself, make sure you've got something on. Okay. Protect yourself. Rule of thumb, like I said, 6 feet from the source is safe. Okay, guys. So we kind of ran through and talked a little bit about radiation safety. I hope this made sense to you. If you have any questions, please let me know. And this class will actually count as your radiation safety course. So anybody that's just starting or has even been here for a good amount of time, they still need to watch this video and mark in the book where it asks if you've been through a radiation safety class. Okay. take what was said and put it to practice in your daily clinical lives. Okay, the biggest ones is adhere to the technique charts. Okay, position well. If you're uncomfortable, practice, practice, practice. If you ever have any questions, please let me know. Look back at the classes that we've had. We're also going to come out with just dedicated positioning classes that are going to be on the Intranet Hub. Okay, that's where I'm going to post all this stuff. So get on there and like the radiology page, and we're going to do good things here. So I appreciate everybody's hard work. I know that sometimes doing X-ray isn't the funnest thing, but it's something that is good to learn. Doctors are going to love you if you can produce great X-rays. Okay, it really helps in the diagnostic end of things. So if you have new employees out there that haven't watched this, please remind them to watch this and get those books signed, which are going to be in every clinic, and it's going to be in a binder that should say X-ray safety class sign off. Okay. Anyway, thanks for watching this. You guys have a good, fabulous day, and we will talk to you soon. Thanks, guys.